A light at the end of the tunnel for the coronavirus pandemic as more vaccines are becoming available and we are starting now to see a spike in cases overseas. It is causing some concern among health officials here in the U.S. Joining us this morning to break it all down is Associate Professor of Biology from Loyola University, Dr. Christopher Thompson. Thanks for coming back with us again.
Thank you for having me.
Let's start off with this increase in cases that we're seeing overseas right now. It's causing some countries to go back into lockdown. So what are we going to learn from that?
Right. So we're concerned that that's a predictor for what's going to start happening here. And in fact, as you were reporting earlier, in Maryland, the numbers aren't great either. We've seen a 21% increase over the past 2 weeks in number of cases and a 41% increase in the number of deaths over the past 2 weeks. And this is all while the nation has dropped by 9%. So we're really concerned about what's going on in Maryland. And we're concerned that this European surge and these other places could be a predictor of what's going to come here soon, too.
What do we think when it comes to the vaccine and its protection against these new variants?
Right. So there are three main variants that we're concerned about right now. We have the so-called UK variant, and it looks like all of our vaccines are equally protective against that one. The South African variant is much more troubling. So it looks like all three major vaccines have less efficacy or less antibodies produced. And then for the Brazilian variant, Pfizer's vaccine appears to be about the same. We don't have enough data for Moderna, and Johnson & Johnson appears to have lower efficacy. So it's still good. We still get some protection, but not the 94, 95% that we were hearing about with the original strain.
And across the board, we don't know how long we have protection for once we are immunized.
Correct. Yeah, we don't know that. There's a lot of unknowns still. We just started vaccinating the vast majority of the population a few months ago.
Right. And Moderna, we know, has a booster. Pfizer's working on a booster that they may or may not use. Is that right?
Right. So Pfizer is interested in having some sort of third booster, especially one that's kind of more catered towards the variants. But, all this is going to require some testing before it rolls out.
Okay, and then talk about this testing now of the vaccine on children. I believe it's 6 months to 12 years old. First of all, how difficult is that going to be to get parents to sign up their young children for something that's very untested and untried?
Yeah, I think that's going to be a big challenge. The technology seems to be proven. We're not seeing many adverse effects in adults, so I'm hopeful that parents would sign up. But as a parent myself, I'd certainly have to think hard about that.
And we're starting to see more people get vaccinated. And so more people are talking to each other about the symptoms that they're getting. What are you seeing across the board in terms of each vaccine and what it's doing to people younger and then older?
Yeah, so most of the vaccines don't have a huge negative side effect. It seems like for a day or two, you're feeling a little crummy. Maybe, especially the Johnson & Johnson, you might get some muscle ache around the site of infection or even that whole arm and even a little bit into your back. With Moderna and Pfizer, it seems like you just feel like you have the flu for about a day, fever, aches and pains. With Moderna, it's about 15% of people who, after that second booster shot, they've reported those side effects. Pfizer's vaccine seems to have a little bit less of those side effects, but nothing major, and it's pretty short-lived for the most part.
And the president talked about eligibility for every American to be able to get the vaccine, of course, based on supply. And then the governor released his timeline this past week. What do you think about this and the effect it might have on really getting things back to somewhat normalcy in our country?
I think that's great. The more people we can get vaccinated, the better. I think our major hurdles to overcome are vaccine hesitancy. So people who are just nervous about getting the vaccination. And I think our biggest problem right now is the rise of variants and what appears to be our lessening concern with masking, social distancing, things of that nature. I think that we're starting to see these numbers go up, and the more numbers that go up, the more the more variants will appear. Will spread. We really need to be vigilant.
Well, and so let's talk to that point right there, because some people believe that if you get the vaccine, you shouldn't have to wear your mask anymore. Now we have these other variants out there. There was a big debate between Rand Paul and Dr. Fauci this week about masking. The masking situation seems to fall depending on which way you believe. So what's your thought on all of this?
Masking has consistently shown to be effective, and so we should continue to do that. The CDC says that if you are vaccinated and you're visiting vaccinated people or people of low risk, you might not need to wear your masks. I think that's not conservative enough. I think that you really need to assess how safe it is for all those people involved. Not everyone, the vaccine doesn't hold for everyone, so some people can still get infected. And, I think you just have to do a real risk assessment for what's safe and what's not.
All right, Dr. Thompson, thanks for joining us this morning. Really appreciate it.
Thank you so much for having me. Stay safe.